Good afternoon. This is United Medical ACO. Welcome to our weekly updates. Today is July 8th, Friday, 2022. After having a little bit break, like 2 weeks, right? So now we are here. So Sean is with me. How are you doing, Sean?
Not too bad. How about yourself?
Good. So we have some updates, as well as we have a guest speaker from United Medical RCM team. Katie Needles will be with us. And I am hoping that everyone can hear us okay, because after 2 weeks, I feel like I lost some of my ability to run this. So, we'll start with our COVID updates. Let's see what we have here.
So as you get that visual pulled up for everyone, I'll just go ahead and give everyone a brief recap on kind of the past 2 weeks. Where we do get our COVID numbers from, it's the CDC's website. That's what we've been using for all of our live sessions. And there was a break with the holiday, the July 4th weekend. So there was a little bit of a lag, but just to keep in mind, we didn't have our live session for 2 weeks. So some of these increases would be a little bit higher than what we're used to seeing on a weekly basis. So with that said, the average daily new case count for the United States is back up over 100,000. So it was at 108. And the US is also leading in the daily average on cases and deaths per day. However, that number is still significantly lower than what we saw with the Omicron and Delta variants in times past. As we go down, we see that it's sort of plateauing with the daily average of cases. Like I said, we're right around that 100,000 mark. Again, and the US is also leading. Remind everyone that the cases may be increased, but the mortality rate is not as severe as what we've seen in the past. And then, as always, we do have our vaccination updates. So the CDC now has, if you're seeing in the slideshow, a graphic on their website, which is actually going to display the age groups of the populations, as well as what percentage of them are able to get vaccinated, of those, which ones have received one dose and which ones have gotten a booster or fully vaccinated. So that is going to be a better visual for those who are looking on the CDC website, kind of easier to read and comprehend, as opposed to reading a chart with just the data displayed on file. So the US is up over 220 million people being fully vaccinated. It's at 222.3, and about 106.5 million having received their first booster dose, and 18.5 having a second. And then
in the meantime, in Europe, the numbers are going up,
Yep.
right? So in France,
Correct.
Italy, Greece, those they're hitting 150,000 cases, but they're mild cases. The hospitalization is not happening. So I'm just checking actually what happened yesterday, because when we were looking at it, we had the day before. So the France yesterday with 161,000 cases. Germany is at 117,000, and Italy is at 108,000. So compared to 2 days ago.
Yeah, so the number that we have is from 2 days ago that you'll be seeing in the live, which was France at 154,000, Germany 135,000, and then Italy was at 108 2 days ago as well. So that's the visual that you're seeing on the video at home on your screen is from 2 days ago. The numbers that Kemal mentioned before are actually from more current days.
So from today, and then yesterday we posted about 91,000 new cases. So now, I mean, I think the season, this summer time is probably helping with these cases.
I agree.
Well, it helps the spread, but it helps the maybe the cases being mild, because it's
weather. People out and about. It's not you can just think of your common cold if you're staying in the house, in a locked up room, no fresh air, you're not out about, your body's not moving, you're not getting the circulation. Just your daily activities are also going to impact how your body responds and your immune system. But yeah, definitely this summer, like we said, we had the 4th of July weekend. People are out and about traveling. I'm sure there's large gatherings. So we are expecting the numbers to, like I said, they are plateauing, but as we move forward in the fall, that's when we might be seeing a more significant spike as we get to the fall and winter months.
Sure. So we have Katie Needles, so I know she has meetings and stuff, so I don't want to take too much time from her, so I'm going to ask her to join us. Then we can cover the RCM part. Katie, how are you doing?
Good, how are you?
You look great.
Thanks.
So we are gonna go over the RCM side of it, and thank you for joining us. Timely filing and insurance takebacks. This is maybe more for our clients and also for our employees as well, but also even the patients, if they are part of the cycle or circle, then they can actually see what issues we are going through. And when I see these types of issues, the state of the state that we are in, state of Delaware, the regulations have something to do with it. Lieutenant Governor Bethany Hall, she was just here like 20 minutes ago. And we need to be able to address some of these issues with them as well. So I do want us to kind of like communicate these, and I know you guys are the great part of this communication and the way that you guys are managing these. So tell us what you have.
Sure. So I actually was on the phone with a patient today and had to explain this process. So like you said, it definitely isn't just for the providers. It's something that patients need to understand as well.
Yep.
So I know that we have the slides up. I'm not sure if that's in the background there. But firstly, timely filing is essentially a set of a time frame in which we can submit claims. So every insurance can be different. It depends whether it's government or commercial. And essentially, if the claim is not submitted to the insurance within that time frame, it has the potential to be denied for timely filing. Go to the next slide, please.
So remember, video is going to run on its own. So you have that's the video running on its own.
I think so.
Are you?
Yeah.
That's okay.
Yeah.
I can keep up with it.
Yeah. Do you have your PowerPoint with you?
I do not. I'm sorry.
We can print one and bring you one right away. But you can go.
Okay. Yeah. So the video, like you said, is running in the background. So after that first part of what is timely filing, we go into timely filing ranges. So that is going to depend based off of the government insurance. So Medicaid, Medicare, they generally have like a year's worth of timely filing, as opposed to some insurances such as AmeriHealth Caritas or Blue Cross Blue Shield, Aetna. They're going to have a smaller timely filing range, so a smaller limit in which we can actually submit those claims.
So now when so we are on the timely filing part where each insurance has different time limits, different initial requirement versus they have different requirements for the corrections. So it's kind of like a tight time frame that we have to kind of move very quickly, right?
Correct. So that can be 90 days. It can be as short as 60 days sometimes. Sometimes it can be as long as a year. Where we tend to run into issues with that is if there's any problems. In a perfect world, everything would be submitted within that time frame. But what we often see is if, for example, coverage was retro terminated. So if a patient had Blue Cross and then Blue Cross went back and said, you don't have this anymore, the timely filing for their new insurance comes into question. And it is a little difficult to receive payment from that new insurance. We do have to fight with that.
Sure.
In the loop that's running, I did include like a screenshot of what a timely filing denial looks like on our end, but that does actually transition us into what are insurance takebacks. Did you have anything to say about that? You want me to just keep going ahead with it? Okay. So insurance takebacks is just the term that we use for payment recovery whenever an insurance is trying to recoup money. Sometimes it's because, like I said, coverage had terminated, or maybe they paid an error. Maybe they paid over the amount that they should have. Unfortunately, this doesn't always provide a simple solution because we have to appeal the claim. We have to fight with the claim. And as Kemal had said earlier, we do have legislature in the state of Delaware that does prohibit takebacks past 2 years. However, based off of the terminology with it, it does give a lot of loopholes. So it excludes self-funded plans. It excludes anything for fraud, waste, and abuse, which is a really large category. You can pretty much throw anything into fraud, waste, and abuse. So that limitation doesn't really stand as much as we would like. After we receive an insurance take back, we do have to try to appeal the claim with the insurance and work to get that repaid.
So if you can actually maybe repeat that one more time. So you're saying that if they're self-funded and if they are in that group, what happens with them again?
So essentially, if a plan is self-funded, it is not necessarily held up to that legislation. So normally there would be a 2-year statute for the claims to be retracted or for the insurance to take back their money. If it's self-funded, that's not necessarily true. They don't have to abide by that statute. And we've seen up to 7 years actually where an insurance has come back and taken that money back, which is kind of difficult to deal with.
When I was in our Turkey office and I was doing the training and this whole issue of what's insurance versus what's third-party administrators. So there was that still like the perception is just like here, insurance company is, everyone is insured. So what you are explaining is not everyone is insured because insurance company like Highmark, let's say, or Aetna, their insured population, what they actually take risk is maybe 25%, but 75% of their business is administrating third-party, like self-funded plans. So let's say one of the big hospital systems or state of Delaware, so as an employer, they're self-funded, but they utilize third-party administrators. In this case, it becomes like an insurance, but they're really not an insurance company. It's the in the insurance company, it's running as a different, maybe different section, different department, so that they may actually be, they may be not included in the actual regulation that the insured population is being subject to. So we have the same issue when we have like problems with the claims not getting paid. Then I tell you guys, okay, well, let's file a claim on the insurance commissioners with the insurance commissioner's office. And if it's a self-funded plan, there is not much they can do.
Right. And so the insurance commissioner complaint, it seems like it should be the end all be all, right? So if we're appealing to the highest authority of insurance, it seems that we should be able to get this issue fixed, but they don't seem to have that much way with these plans because that legislation, it doesn't match.
That's it. Honestly, like this topic is important, but it puts a bigger emphasis on this insurance versus TPA business, which really, like most people, have zero understanding. Go ahead.
That were most of my slides. So if you
just got your slides and you finished.
I know. I just got them, but I did remember most of what I wrote. But
so let's actually then. I thought maybe you had a couple more, so I didn't want to ask too many questions, or maybe explain a couple of things. So what we see, like this is also important for our clients. So we work on claims. So then let's say we saw the patient in like April 2019. Well, December 2021, we have a take back. This can happen, right? So that's more than 2 years. Let's stay in the 2-year limit. So let's say in March 2021, we got a take back, meaning that insurances are not paying us like cash, right? So then they don't come here and then they say, here's your money. So they have access to our outstanding claims. So they do an offset.
They're garnishing, essentially.
Yeah. So they take the money, their mistake, 2 years later, they come back and then they say, oh, well, we had a little problem there 23 months later. So they said, I'll take this by not paying you for other patients on other claims. So that's exactly what we have, what's happening. Now, on one side of the issue is you are addressing the regulation part of it, but the other side is now we have to take that. Number one, we have to also know this, and then we have to be notified, but most insurances don't. Then we have to find the right insurance, and by the time that's already 2 years, and it's just like the most oxymoron process ever.
Right. And in that statute of limitations, it actually does say that the bill also requires 30 days notice to healthcare providers regarding an attempt to recover overpayments. But again, if you don't meet the criteria, that doesn't matter. So if you're self-funded, if you're part of the state, it doesn't actually apply to as much as you would think. When you're talking about the takebacks as well, we do have a time frame to fight that. So say if the insurance takes back, we file to the new insurance, we get denied for timely filing. We can fight that, but we often run into then timely filing denials. So now we have to fight with the new insurance to convince them that this other insurance mixed up. And so it really becomes a rigorous process that doesn't always result in payment.
Right. And it's and in some cases, this may end up impacting our patients in some way that we may end up billing them because it's coming from their insurance. And sometimes they are really unhappy.
I mean, I would be unhappy if I got a bill after 2, 3, 4 years and I thought it was taken care of. So,
but I think what's important though is like they need to know that they are also part of this process, and you can't just say that, well, I don't know anything about my insurance. No, you need to get to know your insurance because insurance are also sending explanation of benefits, so we need to read them. They tell you how much copay, how much co-insurance, what's paid, what's not. So you don't need to wait to get a statement in some cases because you already got the service. Feel free to pay us without getting 5 statements because we won't send you 5 statements, right?
There's the running joke that doctors are the worst patients, but I'd argue that maybe medical billing reps are the worst because I'm always very particular about when I pay my copay.
So, well, I do pay my copay. So I own the practice. I still do because I don't want to get out of the process. Like there's that expectation, right? So, but these are all part of this. I mean, this is our daily work flow that we always see these types of problems. So, like you actually went through one of the biggest take-back fiasco in December 2019, right?
I think so.
It was more than
still dealing with the aftermath, unfortunately.
For more than $200,000. That wasn't even. We were not notified, and they just start taking the money. And like by the time you try to fix those, you find out that there's self-funded, and there's this, there's that, and it needs to be managed better from the state regulation standpoint. And I think with our guest speakers in the future, we can bring up this issue time to time so that they can actually pay maybe a little bit more closer attention. Well, Katie, thank you so much for joining us. Feel free to stay with us. We are going to talk about the global crisis and other stuff, but I know you are busy.
I think I'll watch from the background.
All right. Thanks. All right. Mr. Donovan. So what do we have?
I am back.
You're back.
Sure. You can still see me.
So we're going to actually demoralize and give depression causes for people who are watching the rest of the.
Get you in a sad down mood.
Right. So, okay, well, maybe we should have done Katie's part of the last, so then they would have a better start for their.
More optimistic.
Yeah.
All right. Well, hopefully they can battle through with us as we go through these topics here. To kick it off, we do have our global current events update. So just remind everyone kind of what's going on regarding like the war, our global economies, and just international news and headlines that may be impacting us here on our end as well. So some of the things that we did want to talk about initially that we had at the beginning of our slides here, I'll just go in order as they play on loop. But the Russian and their oil exports and what that's doing for the country and their revenue is a big topic. I know a lot of people initially were thinking that with the sanctions placed on them, that their economy theoretically should be doing worse, but we're seeing it maybe
like this is what we discussed maybe like the 2 sessions ago, right? So one of the things that we believe that may be happening is well, Russia may not be really, they may not see the damage that we were hoping that they would, because this may be, the entire thing may be all staged. So because the losers, when these things happen, you need to look at who benefits from it and who loses from it. So one of the things that you and I, we were checking the strength of dollar and the Russian ruble. So against euro, right? So and then I know we have, that thing is on the first video, I believe, right?
Yeah, so that's actually in the other slide. So this slide that's being presented now is just covering, we have the Russian versus Ukraine gas image that you'll see. And then we also have the graph showing the Russian federal government's revenue and expenditure. So that is with the note, if you see at the bottom, may be hard to read on the screens at home, but it is noting there that despite the sanctions that are going on, Russia is still on average bringing in about $1 billion a day with their revenue from oil and gas. And as you mentioned in regards to the euro and the ruble, that is displayed on our second video that we have with the US economy, now the US dollar is doing.
Sure. So why that's important, right? So why that's important is because there's a big crisis there, and who's benefiting from this? So is it like, if Russia was losing, then it's, well, how many months now? 5, 6 months? 5 months, February, right? So
February,
then it would be already happening. That didn't happen.
But it's the reverse.
Where the money is spent, who's spending the money, whose money is losing value, is the thing that we need to look for. So there's, some of these things, as we are explaining, it becomes so clear what it is that's happening. But then people are kind of insisting on not seeing, like,
I think some people sometimes they kind of just get their initial reaction and what they think is happening, and it's hard for them to then change their minds and reprocess once more information comes out. I know that there's a term.
We don't want this to be at the president level. So the president is doing this. Right. Our president is doing it. Right. So, like, first he blamed the gas station owners. Well, they don't reflect, like, they don't have any stocks to just play with the numbers. So then this is how much they're buying it for, right?
So you don't just pick what number you want to share.
We are going to be gentle with Biden today, so we won't go too far. But here's the interesting thing. So that I did when I was in Turkey, the Ankara to Bodrum. So what they didn't have, it's just one. One class. So there's the economy, there's a business, so it's everyone in the economy. So the best bet that you can do is the exit roll. So so I actually thought about you when this happened. So my mom and my dad, they were with me. Mom 71, dad 81, and I paid extra to get the exit seat. So guess what happened? They were not allowed to sit on the exit row.
Because of the emergency.
And I said, well, you can be the president of US, but you cannot be sitting on the exit row, like, right? So, but we won't go too far with Biden today. We are going to be gentle. So, but that was kind of interesting. So there's a rule who can be sitting on the exit row, who's sitting on our exit row, this country's exit row. Like, I was kind of like really thinking about that. I'm like, so
sit behind a certain desk or sit in the exit row.
So, and it's kind of interesting that people think that if there's something happens on the plane, like, the exit row people are going to help the others. That's kind of like,
most tragedies might be out of the exit row people's hands, I'd assume.
So, well, my sister was next to me, and then there was a little gap there, so the bump, and she was trying to actually run, but she was already on the exit, so she couldn't go anywhere. So it's kind of like interesting that people even, like, if we have rules for that, I don't want the rules for the higher positions. So I think it would help. Now, the reason, one of the things that I'm mentioning this is because right before this abortion issue with the Supreme Court decision, there was a planned nomination from Biden. The guy who was anti-abortion judge, he's the guy, I think it was the guy, anti-abortion judge being nominated almost for
Mhm.
the Supreme Court.
And
So-
it happened. I think it came out a day or so right after where the decision was already made, where the nomination actually didn't impact. But regardless, it was interesting that
Mhm.
the side that he was promoting was actually the anti-abortion, pro-life.
And now we are talking about one of the biggest, maybe, I'm not going to say nonsense, but I think maybe overrated issue. Everyone is talking about the abortion, and not everyone is on the same page. We all understand, but then maybe Biden was going to contribute into that. So,
it could,
right, like
depending on
if
the
that
timeline.
didn't happen, like
He
with
would've-
the ruling, actually the Roe and Wade versus Wade. If that ruling didn't happen, that was going to happen maybe a month later with this person, and it's nominated by
I think it was kind of decided on which way it was going.
the exit Roe policy age limit is needed. So now let's look into the U.S. A little bit. So the inflation May inflation is at 8.6.
Yes, so it is obviously behind a month as you do their calculations, but for May of 22, it is at 8.6. And if you'll see on that graph, it is a steady uptrend. And back in August of 21, it was at 5.3. Now it's at 8.6. So you do see that steady increase up into the 8s, almost approaching 9% now in some. And just to remind everyone, this is just the average. There are certain sectors in industry that are way higher just based on certain goods and demand. So for example, our oil and energy, you'll see at a period we had used car prices were skyrocketing when the supply was low with the COVID and manufacturing ability. But yeah, just as an overall trend, it is going up. And also on this slide, as it's being displayed right now, is what you had mentioned earlier with the euro versus the ruble. And then we also have the US dollar versus the euro. And just as you see that the US dollar is increasing in value, it's around 15% increase from July of last year. And then the Russian ruble versus the euro has actually increased around 45%.
So let's just repeat that. So 15% US dollar becomes stronger.
Correct.
Against euro. But more interesting is 45% is the Russian ruble is stronger than euro. This is 1 year.
Yep.
Right.
July of 20.
So now, because these things are going to be on the internet, and then I don't have to tell people, listen carefully because this is going to stay there as a recording. So then I don't have to say I told you so, people. But do you remember what I shared with you on Twitter last night with the NATO?
Mm-hmm. Yes.
So our former president was complaining about the budget, the expense, which we talked about that maybe 3 months ago. We said, look, all these people are going to spend more money. People meaning Europe, they are not spending enough for their defense. When they don't spend enough, we are not really trying to be protective of them. So let's just be careful. We are selling the defense, the arms, the weapons and everything. So then that's how they're going to make our money. So then they have to spend more money. And then Trump did say this in 2019. What was that video? Yeah. So, and then now we have NATO, who is spending more money. So because they are all increasing their budget, defense budget. And while that's happening, the US dollar is going up and the Russian ruble is going up. Now, Europe is right in the middle. So then here's US and then here's Russia. That was my pencil. So remember, Europe is right in the middle. So then these two are winning. So think about it. Yeah. Now, also like what just happened in England yesterday, they lost their prime minister.
I did see that.
The crisis is there. So actually, we forgot to mention the pound, the British. They're losing against dollar and ruble. So this is something that we want people to kind of know why things are happening and what we may be expecting. Now, outside of this, I just want to give you guys my own, like on the personal level. I was in Turkey for 2 weeks, and you know, I already shared what I was thinking with what's happening here. Every time I go out somewhere, people are spending crazy money. It's extremely crowded, and the way that Turkey economy is being reflected, I was expecting things to be really bad. So all restaurants are full. I haven't seen Turkey like that in my life. All restaurants are full. You have to wait 20 minutes, 30 minutes to get into any place. Traffic is crazy. And people are spending. This inflation is happening because there's a demand. So people are spending more than what they should be spending. So they're buying this Generation Z. We are not going to group them and then just blame them all because Sean also is Generation Z. So there are good ones in the generation.
Yeah, some outliers.
Right?
Yeah.
So we have to be responsible. We can't expect everything from the government. So the government is not a different body. Like that's like you, me, and other people who are the government. So if people are not taking care of their own personal issues, then blaming government and not following what's happening, that's again, this is going to be the second time I'm using the oxymoron, but that is oxymoron. Like you can't do that. You can't be spending that much and expect to have good economy. You have to live below your means. And that's the fact. Right now, like Turkey is going to be off 9 days because the religious holiday is 3 days, and then there's something else happened. And now with the weekends, that's entire country is shut down. If you are in financial crisis, how can you shut down the entire economy? Now, in the entire country, fine, the government made that decision, but people are also fine with that. They are happy. Yeah. So that means we are not taking responsibilities.
Time off,
right? So
yeah,
that's great.
Just to mention a separate article I was actually came across, I was doing some of our prep for this session, which I didn't include it, but I just feel since you went on with what you just said, I'll mention there's an article of a research study that found back with the relief checks that were initially sent out with the COVID relief pandemic when it was initially happening, those $1,200 checks.
Mm-hmm.
They were saying that they did a study based on the people's level of income and that how much they got with the check, because we know there was different bands on how much income or how much you were getting from the government. But it was actually interesting to see that with the money dispersed to the people, that is the people in the lower groups, that they increased their spending by like 60%, which granted $1,200. I mean, obviously you're going to use the money to pay bill, but it was, instead of being a conservative approach with let me use this wisely for necessity like bills, it was their percent of spending increased much more than say people that were at a higher level, which it makes sense if you're thinking about the income, which what you're going to need to spend. But
this is supposed to be offsetting something that they lost,
right?
But then in fact they actually didn't maybe lose, right? So that's what the issue is. So then they just spend it,
right? So the point that you're saying is it wasn't a wise use of the government money, and then I know there's a lot of people that's like, oh, we need more. So that can't be your fallback to where you kind of have to take care of yourself.
So we want to have our cake and eat it too. That's the main problem. And like this is not going to probably change for me. Like I see this every year in my life. There are people, but I think we have more of those now than before. Yeah. So something to think about. So we do have we have our which we wanted Kyle Gay to be part of this discussion, but she is avoiding me, and I don't know why. And I promised her that I was not going to make fun of her name, her first name, not last name, but we cannot make fun of her last name anyway. So, but the first name
or middle name,
or middle name, right? So, but we wanted to discuss the abortion issue with her. I still don't have I should say I don't have a clear understanding. Obviously I do, but the way that this thing is covered in the media is overrated. I don't think people are being honest with each other. And now I'm afraid that something bigger is going to come out of this. So we are hoping that Kyle can join us.
Yeah, I mean, this obviously with an issue like this, it's clearly polarized. It's either, all the way this way, or there's not really a middle ground, these types of issues, whereas other more controversial issues may have a compromise. this one is kind of polarized, where you're seeing two distinct, ends of it: pro-life, pro-choice. And one of the things that's kind of going on with it is, obviously, it's not in the state's hands. So each state has their own what type of restrictions or liberties they feel should be associated with the issue. But we're seeing that in some of the articles I was looking at, that states are actually modifying their decision almost on like a daily basis or week by week. So what they may have agreed on a week ago is now no longer. We're now retweaking it. And I think it's like you're saying, there might be a bigger thing coming out of this. It's interesting to see how some of the companies are responding. I know I've had friends who've mentioned that their companies are offering. There's one company that said that they would spend $4,000 to pay for their employees' travel expenses if they need to go to a different state to get it.
But that actually, I just saw something this morning. So when that happens, those clinics in those states are now overcrowded, and they're going to deal with patients who are not their patients. They are known entities. I think this thing is out of control. I mean, let's see if we can bring we can try one more time to bring Kyle to see if she's able to explain this to us, because she's also a big supporter of abortion. Now at the personal level, yes, this is the woman's decisions, fine. But at what point? Like, so if the baby is 8 months old and then you are still going to be able to take that baby out. So one of my OBGYN practices, well, she's one of the first OBGYNs in Delaware. She used to do abortion apparently in the old days. I ended up, like when we go to our clients' offices, we go everywhere. And there was this room that says, don't go in. But I did, because it says don't go in. So, and that was the old abortion room. So the way that thing is being processed is, I cannot really explain that. So that was one of my big traumas. Like, I wish that I didn't see that room setting that way. Like I'm talking about like vacuuming and just like, shredding and stuff. Yeah, I see your face now. Because of that, I mean, I may not be too objective, but I think there should be rights. This shouldn't be like if someone, if it's early on, fine, but it cannot be used as a birth control. Like,
there's definitely other
that
means.
cannot be. And if someone is raped and they don't want to have that child, fine. But it's 7 months, and then you are now going to decide. And then also, what happens to the father? Like, what's the father saying that?
Yeah, right. They have input.
So, right, there's a being, like live being, and losing a dog 4 months ago, you appreciate life. So then you are actually taking that life for what reason? And if it's just a birth control, that's, I mean, I have a problem with that. So I don't care if people hate me by saying this, but there has to be some base for why you are making that decision and why you have to make that decision so late. If it's a medical reasons, fine. But it needs to be limited with the proper regulation. But now I think this issue, I'm not really happy with the way that this is being covered in the media. So it's just like everything else is being like, oh, the one party wants one thing, the other party wants the other thing. But then in the middle, Biden is trying to nominate someone who's anti-abortion for the Supreme Court, and which was the biggest deal, but no one talks about it. Again, people have to do a little bit more reading, or they can watch us, and maybe after they hear it, they can go back and read.
We'll tell you a couple of weeks before you find out about it.
Actually, we have been doing that for a while now. So, and we have one more topic, right?
Well, in this, we also did have, like you're saying, with these controversial decisions and what laws are out there. I know we had touched on it previously a couple of times, but with the gun control and gun violence, we know that there was another shooting at the 4th of July parade in Illinois, and there's again a push for these type of regulations on who can get the firearms, what types, the background checks, which if you look at the regulation standard procedure that they had in this particular case, the person did they they passed the background check, or if you were under the age of 21, I think it was in Illinois, you have a parent kind of like approve or co-apply with you, or have a parental at least aware of what was going on. And like we said, in the particular article I was reading, there was a former FBI, I don't know if he's in the field agent or what his position was, just a former FBI employee, but he was saying that the amount of people, if your population of probably 330 million citizens, of the population that's eligible, 18 years of old, that pass this background check, he's like, the amount of authorities they have to monitor all these people at once and keep an eye on it, it's insane, the ratio of what you'd have to have. But at the same time, he's like, you can't judge someone for being weird. They have the same rights as, whatever their hobbies are. Like, that's what they're saying. Like, with particular shooters, like, oh, this guy had signs, look at, maybe he listened to this type of music or dressed this way. It's like, you can't judge people just for being weird, but at the same time, there is, certain background checks and initial.
Well, the background check, psychological evaluation, age, these makes differences with this, and what type of gun we can get.
Mm-hmm.
I mean, that shouldn't be available at any level. So there should be some, again, there has to be moderation. So many people, and since we have an office in Europe, so we don't want people to think that getting a gun in Turkey is extremely difficult. You need to have the governor's signature on it for the concealed weapon. Here is extremely easy. I mean, there's still some process, but too easy.
Yeah,
like I mean, there's a couple of steps. I mean, I have it, so it's been for 15 years. It shouldn't be that easy.
Yeah, again, that's another thing where some states it's more challenging. There's more rigorous background check. More others are. The
exit rule should be there too, right? Yeah. So if they cannot make the decision on the exit rule, maybe they shouldn't own a gun at a certain age, or maybe they do. Like it's like you can't take certain things away from people, but you can regulate them. Just like the speeding, everyone is speed. They go over speeding limit. No one gets in trouble, but some people do.
Yeah, there's that.
The extremists do, right? So, but the main issue today for us, for the US, is the economy. So all these things are, I believe, they are kind of like distraction. So like, look at this, look at the abortion, look at the ground control and this. I mean, these are always happening. And then unfortunately, this is not just in the US, it's also in Turkey. Like there was a shooting happen in one of the hospitals, I believe. And they made it sound like if this was done for the entire health system. So the guy who killed the other guy worked in the hospital. Mm-hmm. So he was actually security guard. So then my understanding is he actually, this doctor operated on his mom a month ago. I think there's still more details. I mean, this is how much I know as of yesterday. And mom died. And this guy killed the doctor. So the media, I actually hate it. Like I hate how dare they are trying to paint everything based on how they want you to see the world. Mm-hmm. And that's not what it is. So they're making it sound like the entire society hates doctors. So we had 2 doctors killed, 2 surgeons killed, remember in Nevada, right? Or Nevada, yeah. So it was
the chiropractor guy.
No, the surgeon. Or the 2 surgeons.
I know there was.
This is in Nevada 2 months ago. So in the hospital, 2 of them died. 1 black doctor, 1 female doctor. So
vaguely.
So and no one says, you see, you don't remember because it wasn't covered as like, oh, there's a violence against doctors.
Yeah,
but right now, like this is 89 million people in Turkey or 85. So the way that media is covering this, like, oh, everyone, the government should resign over this. So, well, that's just funny, like in a sad way. Yeah. So, but this is what they do. I think the media needs to be maybe regulated better than abortion and better than the gun.
The problem there is some people, I think, actually do, once they hear this, they latch on, like, they'll believe this, like, this is exactly
well,
what
people don't read,
like,
people don't research, people, they're just looking at the headline and then they go, oh, well, I watch CNN, so I should be thinking like this. I watch Fox, I should be thinking like this. So, and that's about people are all intelligent people. Well, use your brain and do a little bit of research and don't believe everything that you hear. And like there are some stuff that we didn't want to include in these sessions because we don't think it's a reliable source. It's a funny news in some ways, but I mean, taking that responsibility and then just, tweeting everything or just sharing that fake news or maybe inaccurate news, that shouldn't be the case.
So credible information.
Now, I didn't mention this with Katie. Right before this one, we had a meeting with our Lieutenant Governor, Bethany Hall, very nice lady. And we are hoping that we can actually get to know, our goal actually for her to get to know us a little bit more with services and everything that we do. And she was extremely impressed with our clinical integration, care coordination operations. And that was kind of like a refresher for us because it's nice to have others to appreciate what we do. And we'll get to host her, right?
Yes, I think the plan going forward, I know we kind of talked about each other's schedules a little bit, but sometime in the near future, we're hoping to actually bring her on one of our live sessions so we can kind of dive into a little bit more detail on some of these healthcare topics and kind of get.
She's very knowledgeable.
Yeah, I was going to say she has a great background with her nursing, her master's in nursing, and the work that she's done. And she also still teaches, as a professor at the university. So to get her insight, kind of be able to discuss these topics with her, I think is going to be real beneficial for both sides and our public too. So.
Sure. And 3 p.m. Bariatric Friday is back with Dr. Erkan. Well, with Bariatric Friday, Samantha and Katrina are back. So they're getting their surgery process. So Dr. Erkan is going to explain the resolution of comorbidities with bariatric surgery. And I'm hoping that people will be able to watch or catch up with us later on. Thank you for joining us. Thank you for watching us. Sean, thank you for being part of this. And we'll see you guys next week or